Okay, I think in the interest of time, because we know you all are busy and we have a great lineup of speakers today, we'll go ahead and get started. Good afternoon, everyone. I'm Sarah Manji, a Public Policy Officer at the Colorado Health Foundation, and I'll be facilitating some of today's meeting and mostly just welcoming you all to the webinar. So thank you for joining us today. This is the fourth webinar in the Reimagining Housing Solutions Learning Series, and we're so grateful that you set aside time for this today, and we truly hope it's an engaging and beneficial 2 hours for you. So as folks continue to join the webinar, we invite you to introduce yourself in the chat so we can get a sense of who all is attending. And we know we have attendees from all around the state today, which is really exciting. Before we get started, I wanted to take a quick moment to thank the series sponsors. This has truly been a group effort and lift, and it's been wonderful to work with such an engaged group of sponsors, giving their time and distribution lists and help shaping the content of the series. So the sponsors for this series are Project Moxie, CHAFA, the Colorado Municipal League, Colorado Counties, Inc., Housing Colorado, Enterprise, the COVID-19 Eviction Defense Fund, and the Colorado Center on Law and Policy. So thank you again, sponsors. As I mentioned, today is the fourth of a 6-part series. I can't believe we're already on number 4. And on the screen, you can see, you'll be able to see the dates and times for the next sessions in the Reimagining Housing series. This series has been designed to have each session build upon the next, and so we hope that you can join us through August for the remaining sessions. Today's session, as you can see, is focused on housing stability and working to prevent homelessness. A few housekeeping items before we get going. This is a Zoom webinar, so your cameras have been turned off and your audio is automatically muted. Please use the chat function or the Q&A function to submit your questions throughout the presentations, and the chat function if you're having any technology issues. So again, we will save time at the end for a question and answer period, but feel free to put your questions in that Q&A function down at the bottom of your screen all throughout today's webinar. No need to hold them until the end. Just go ahead and put them in, and hopefully we can get to all of them at the end. One final housekeeping item, today's webinar will be recorded and then posted to the website next week. Each registrant will be receiving a follow-up email next week with a link to that website with the recordings and the presentation. And then a Zoom invite will come a few weeks ahead of the July session, so watch your inbox for that. Before we launch into presentations, just a really quick overview of who the Colorado Health Foundation is. I know some of you might be familiar with us, but hopefully we're actually new to many of you. The Health Foundation is working to bring health within reach for all Coloradans, and we do this by engaging closely across the state in areas of investing, policy advocacy, learning, and capacity building in order to advance this mission. All of our work, we seek to improve health equity in the lives of those who live on low income or who have historically had less power and privilege. We're a bit unique at the foundation because we have a dedicated policy team that I happen to be a part of, and we work closely with our grant making team to further our strategic priorities, one of which is affordable housing, which is why we're helping lead the webinar and this webinar series. And specifically, we have a goal internally of helping reduce the number of households living below 80% area median income and spending over 30% of their household income on housing, and working to increase folks' ability to live in the community of their choice. So it's an honor to get to work in this space and engage with all of you. So enough about the foundation, let's get started. Today, before we dive into the presentation, we just want to get your brain going and thinking through about this topic in particular. It's going to be a great webinar today. So let's take a few minutes and do a poll. Hopefully it just launched on your screen, and it reads, based on data from the National Alliance on Homelessness, how much did unsheltered homelessness increase across Colorado between 2019 and 2020? So you'll note that this is pre-COVID, and we're just curious, as kind of a baseline level, what y'all's best guess is. We'll give you a few minutes to click answer. So 42% of you thought 18%, 27% thought around 33. I'm saying a lot of percentages. This is kind of an awkward way to say it. But almost majority of you thought 18%. And Matt, I believe, if I'm correct, and you might be able to share a little bit more about this at the beginning of your presentation, the correct answer is 33%.
Yeah, so between 2019 and 2020, based on numbers from the annual point in time count that happens in January, so this was prior to the COVID-19 pandemic, we saw a 33% increase in unsheltered homelessness across the state of Colorado. So,
yeah, that's a pretty drastic increase even pre-COVID. So a lot to think about as we move on to today's presentation. So thank you all for humoring us in that. And I'm thrilled to introduce Matt Lynn, who was just speaking at Project Moxie, and he'll kick off today's presentation. Matt, I'm going to turn it over to you.
Thank you, Sarah. So I wanted to kick off. We've been trying to provide the most up-to-date information on bills connected to the American Rescue Plan Act, which are represent a historic influx of funding into our state and into other states around housing and homelessness specifically. So I wanted to provide an update now that we are officially kind of at the end of the legislative session. We have a ton of bills that have passed, most of which have made their way to the governor's desk and been signed into law. Some of the more key bills that came out of our General Assembly during this historic legislative session. I will offer a tip of the hat to the Colorado Coalition for the Homeless, who I adapted much of this material from. I saw Kathy was on the call, I think. So they gave a presentation a few weeks ago on this, and I've tried to just kind of pepper in some updated information. Starting first with homelessness, we have a number of bills that appropriated funds, ARPA funds, toward addressing homelessness across the state. For today's webinar, I want to draw specific attention to HB 22-1377. This bill uses $105 million in funds from the American Rescue Plan Act. It's going to provide grant opportunities for communities across the state. So the Department of Housing, which lives under the Division of Housing, which lives under the Department of Local Affairs, will oversee administration of grants, and more information on these grants will be available soon. But as you can see, you can use these funds for things like street outreach, shelter, transitional housing, permanent supportive housing, things that can move the needle to address homelessness in communities across the state. Our second category I wanted to shine a light on is housing investment. So these are bills that are really designed to proactively create new housing units in our communities. Drawing your attention to two bills in particular. First being HB 22-1304, the state grants investment in local affordable housing. This bill, another huge tranche of money, $178 million in ARPA funding to establish two distinct statewide grant programs. The funding in this bill will specifically support development of supportive rental and for sale housing, and this is going to be targeted at populations disproportionately impacted by COVID-19. Again, this is funding from the American Rescue Plan Act. This bill makes a substantial investment for local communities to create strategic development patterns. This includes funding for infrastructure projects, as well as updating land use and codes, which we talked about at length in our last webinar session. The Affordable Housing Grant Program will be administered again by DOH within the Department of Local Affairs to local governments, as well as to nonprofit organizations will be eligible for this grant money as well. More information will be added regarding this program in the coming months. The Strong Communities Grant Program, which is the other grant component of this bill, will focus on funding infill infrastructure projects, and that's actually going to be administered by the Division of Local Government, DLG, which is also part of DOLA. I also wanted to draw your attention to Senate Bill 22-159. This is another $150 million investment for a revolving loan fund. So this will be low interest loans for the development of affordable housing, again, administered by DOH, with more details to come regarding loan eligibility. Lastly, bills focused around housing protection. So this is all about protecting the stock of housing that we do have, particularly affordable housing that already exists in our state. I wanted to draw your attention to one bill that we did touch on in the last session that was signed into law. This is HB 22-1287, Protections for Mobile Home Park Residents. This does a ton to expand protections for mobile home park residents. A reminder, mobile homes represent kind of the last vestige of non-subsidized affordable housing across our state. There are a lot of communities that really, without mobile home parks, there would not be a lot of non-subsidized housing that falls into that category of what we would call affordable, based on the amount of income that people are putting toward their housing every month. The Colorado Poverty Law Project put together a really helpful summary of everything that this bill will do. So I would encourage you to, if you're interested in diving into the minutia of this bill, visit the Colorado Poverty Law Project's website. But it is important to note here that amongst a variety of new tools that will help residents come together to collectively purchase their park when it goes up for sale, there is now a right of first refusal provision for local governments on all mobile home park sales. One last thing I want to say regarding legislation, some ways to just kind of stay updated on these funding opportunities as they get fleshed out and we learn more about them. Bookmark the DOH website, subscribe to their newsletter. I think it's a really good resource for kind of staying up to date. And folks from DOH and DOLA, I know you're on the call, so if I'm missing anything here or you want to add anything that you find would be helpful, please feel free to drop it in the chat. But kind of as a consultant that's in this space, these are the tools that I use to stay kind of apprised on the latest and greatest. Housing Colorado, a sponsor of our series, has a great newsletter with up-to-date info, educational events, webinars, things of that nature. And then I think I've also mentioned this on prior sessions, but the Colorado Sun has a complete list of every bill that utilizes ARPA funding. And if you just Google Colorado Sun ARPA bills, that might be the best way to get to that article. But we will release these slides with all the hyperlinks when we send out the recording next week. Without further ado, then, I do want to introduce Mr. Peter Hepburn. He's a research fellow at the Eviction Lab at Princeton University, as well as an assistant professor of sociology at Rutgers. And he's joined us today to talk about eviction prevention best practices across the country. So Peter, I will hand it over to you.
Thanks, Matt. Yeah, if you could just advance the next slide. All right. Well, thank you for having me on today. Appreciate the opportunity. I want to cover two things in the time that I have available. So first, I want to highlight some new results out of the Eviction Lab on the prevalence of eviction nationwide and sort of put Colorado in national context. And then second, I want to talk about what those findings allow us to say about strategies to drive eviction rates down. If you'd go to the next slide, great. So before launching into that, I think it's helpful to just take a step back. And for those of you who aren't familiar with our work, just explain what the Eviction Lab is. So we're a relatively small research group that's based out of Princeton University. We were founded by and are directed by Matt Desmond. Most of you probably know Matt as the author of Evicted, which was this, a book that came out in 2016, kind of an extraordinary account of how eviction affects the lives of poor renters. And that book was based on years of ethnographic fieldwork in Milwaukee, as well as some surveys that were done in Milwaukee and then close examination of court records. And after the book was published, one of the questions that people kept asking Matt is Milwaukee an outlier? So in other words, have you chosen and have you described sort of the worst case scenario and eviction is actually much less prevalent for renters elsewhere in the country? What does this look like in Cincinnati or in Atlanta or in Denver? And the reality is that we didn't know the answer to that question. The federal government collects almost no data about eviction, and data that are released by the states tend to be pretty spotty. So Matt launched the Eviction Lab with the goal of assembling a national database of eviction records and answering three sort of core questions. First of all, just how common is eviction? Second, what are the causes and the correlates of eviction? And third, what are the downstream consequences of eviction, for individuals, for families, and for their communities? And answering those questions, and just as a first pass, knowing where eviction is more or less common, is really critical in starting to develop solutions. Eviction for a long time has been one of these hidden problems where we just don't know the lay of the land. And we don't tend to address problems that we can't see. Our goal in starting out was just to make the scale of the problem apparent. You can go to the next slide. So we did that back just about 4 years ago with the release of our first national map of eviction rates. And what you're looking at here is that map of county level eviction rates nationwide in 2016. The size of the little red dots across the country here indicates the eviction rate in the given county in that year. So you'll see that these are really concentrated down in the southeastern part of the country, down Georgia, South Carolina, North Carolina, Virginia. That's where we see a really high concentration, as well as up in the Rust Belt, Indiana, Ohio, Michigan, tend to see pretty high eviction rates. But you'll also notice that there are a lot of blank dots on this map. There are a lot of places where we weren't able to access data and therefore couldn't calculate eviction rates. That's been true of whole states, like we didn't have any information about the Dakotas, and also counties within states where we had some data. So for instance, in Colorado, there were 9 counties where we weren't able to calculate these rates. And that, of course, leaves quite a bit to be desired if we want to provide a picture of eviction nationwide. So if you can go to the next slide. Toward that end, my colleague Ashley Gromas and a team from the Eviction Lab have been working over the last few years to collect additional data and to develop methods of estimating eviction statistics in places where we previously just didn't have any reliable numbers. I would very much encourage you to seek out a paper that came out just a few weeks ago in PNAS that is sort of the end result of that process. I can put a link to the paper in the chat. It's short, it's only 8 pages long, but it packs just an extraordinary number of findings into a very small package. Next slide. In many ways, this article represents the sort of the culmination of that original project to the Eviction Lab, which is establishing a national database of eviction records. Ashley and her team developed a set of methods that make use of Bayesian hierarchical models to produce estimates of eviction filing rates for every single county in the United States for every year between 2000 and 2018. Those figures include the total number of eviction cases that were filed, as well as the unique number of households that were threatened with eviction, which is important because in many cases, there are serial eviction cases where some families are filed against more than once in a given year. There are certain things that these new estimates don't do. So for instance, they don't provide estimates of eviction judgments, and they don't provide estimates below the county level, but they do provide, without a doubt, the most comprehensive picture of nationwide variation in the prevalence of eviction. So again, I would encourage you to read the paper, but I want to highlight just a few of the key findings here. So first off, the authors find that on an average of 3.6 million eviction cases are filed annually in the United States against 2.7 million unique households. That means that approximately 1 in every 14 renting households is threatened with eviction every single year. Second, while the overall number of annual eviction filings has been pretty consistent for over a decade, since about 2006, the overall eviction filing rate has dropped over this time. And that's a function of a growing renter population. Basically, the denominator is getting larger as more people become renters. And those new renters, those new entrants into the rental market, tend to be older, tend to be wealthier, and at lower risk of being filed against for eviction. So there's this general trend of lower rates, but a very consistent absolute number of eviction cases that are being filed. And then the third thing that the authors document is really very large state-by-state variations in eviction filing rates. You can go on to the next slide. So here's a sense of just how large those differences are. This is a plot showing the share of unique renter households in every state that were threatened with eviction in 2018. So up at the top of this list, or the second of this list, 1 in 7 renter households were threatened with eviction in 2018 in South Carolina. In Washington, D.C., this was 1 in 10 renter households. Here in New York, it was 1 in 14. Out in California, it was 1 in every 47 renter households, so a lot less common in some places than others. In Colorado, it was 1 in every 18 renter households. That puts you at 19th in the nation, sort of the middle of the pack, but in the upper half of the distribution. So what explains this variation from state to state? One obvious explanation is that it's something about the composition of renters, right? Maybe there are more poor or more especially vulnerable renters in the states at the top of this list than there are in the states at the bottom of this list. But one of the things that Ashley and her colleagues stress in the paper is that demographics explain very, very little of the variation between states that we observe. Go on to the next slide. So if it's not demographics, what does explain why we see much higher eviction filing rates in some places than others? They show that a relatively simple policy difference, whether or not landlords are required to provide notice to their tenants before filing an eviction case with the courts, makes a huge difference in explaining state-by-state variations. If we want to think about policies that can drive down eviction rates, this is the sort of simple, cheap policy intervention that could make a world of difference. The other big policy lever that they look at is filing fees, how much it costs to file an eviction case. And there they find that states that have higher filing fees have lower eviction filing rates. And in particular, they see fewer serial eviction filings, those repeated cases brought against the same tenant at the same address. Go to the next slide. So where does Colorado stack up in terms of these policies and variation across the states? So Colorado does have a notice requirement. So they have a 10-day notice requirement for eviction cases for non-payment of rent. So they meet the basic threshold of offering some notice to tenants before a landlord would file an eviction case. They also have there's a meaningful filing fee on eviction cases. It's $85 if the claim is under $1,000, or $105 if the claim is over $1,000, but under $15,000. The national average for filing fees across the 50 states is, it's been around $116. So you're slightly below the national average, but you're certainly above a state like Maryland, where the average filing fee is $15, or South Carolina, where it's only $40, and where there is no notice requirement. Go on to the next slide. Where I think we need to do more research about policies that are, potential interventions that have gotten a lot of attention recently are on 3 big topics. So the first one is right to counsel, trying to provide tenants who are facing eviction with lawyers. This has now been implemented in a number of cities across the country and is being rolled out in several states now, including Washington State and Connecticut most recently. The initial results that we've seen, especially out of the rollout of right to counsel here in New York City, have been very promising in terms of keeping renters housed for much longer periods of time, slowing down the eviction process, more eviction cases resulting in agreements between the tenant and the landlord that allow the tenant to remain in their unit, or that allow those cases to be sealed immediately after they're concluded. I think one of the things that we need more of in this space are very clear metrics for evaluation of what constitutes success for these, and more consistent evaluations across jurisdictions that show these various outcomes and how successful they are. These programs are designed in slightly different ways across jurisdiction, and they have slightly different eligibility criteria from, what the way the program works in Cleveland is not the same way that it works in Baltimore. I think digging more into the comparison between jurisdictions and the ways that these programs are actually being run is going to be really important in understanding what a successful right to counsel program looks like. One of the other fronts that we're starting to see more action on is just cause eviction, efforts to clearly define the reasons that landlords need to provide in order to file an eviction case, and limiting that to a subset of justifiable reasons. there's reason to think that this could improve, this could reduce the number of eviction cases that are being filed. On the other hand, we also know that the vast majority of eviction cases are being brought for non-payment of rent, which under every just cause eviction statute that I've seen is listed as one of those just causes. So it remains to be seen how much this sort of policy intervention would appreciably change eviction filing rates or judgment rates. And then I think that the third big area where we need to see more evaluation are the wide set of policies that were implemented in response to the pandemic. So we've seen sort of two very large sets of eviction prevention policies that were implemented in response to COVID-19. The first of those was just eviction moratoria. The second was rental assistance, emergency rental assistance. And then I guess eviction diversion also factors in as one additional set of policy interventions. And we have at this point some good research documenting how these policies differed across the states and across jurisdictions. So we know, basic things about how eviction moratoria look different in Colorado than in Ohio than in New York. And we're starting to get a better picture of how emergency rental assistance programs operated differently in these different places as well. But I think there's a lot more work to be done in evaluating exactly what the impact of emergency rental assistance in particular was in keeping people stably housed, both in the short term and in the longer term. I think there's a lot of potential upsides to rental assistance as a long-term policy, especially now that we have developed the capacity to distribute funds more efficiently to renters and to landlords. But we need rigorous evaluation to demonstrate the benefits of this policy and also to start to lay out the costs of not implementing a policy like that. If you could go on to the next slide. I also wanted to just give a sneak peek of some changes that are coming to the Eviction Lab's website in the next few weeks. So in conjunction with the release of this new PNAS paper and the underlying data, we're revamping our website and our national map. It'll look similar to the old map. All of those old red dots from the previous map will still be there, but it has one important difference, that none of those dots are missing anymore. We got 3,000 some counties for a full 18 years. And for every county and every state, there are estimates of eviction filings and unique households threatened with eviction. And next slide. When you plug down to the local level, we also really clearly demonstrate the uncertainty in those estimates. So we show credible estimates for all of the figures that we've got here. We think this is a pretty big jump forward in understanding the scope of the eviction crisis. So again, I'd encourage you to check out the paper, download, start working with the data, and keep an eye on our website. In the next couple of weeks, we'll be releasing this new national map, and we'd love to have you use it and see what you think of it. So I'll stop there, but I'll be sticking around and happy to take any questions after these talks.
Thank you so much, Peter. Much appreciated. That was just a wealth of information. I'm sure we're going to have some more questions rolling in. I want to hand it off to Melissa Mejia. Melissa is the Director of State and Local Policy at the COVID-19 Eviction Defense Project. So we are kind of continuing our focus on eviction, but narrowing our scope to look specifically at Colorado. Melissa, I will hand it over to you.
Thank you. So yes, hi, sorry, pulling up my notes. My name is Melissa Mejia. I am the State and Local Policy Director for COVID-19 Eviction Defense Project. So the COVID-19 Eviction Defense Project was formed in April of 2020, specifically to work with a mission to keep Coloradans housed, helping to prevent mass evictions and homelessness during and then after the pandemic. In 2020, essentially, a team of lawyers pooled their resources to provide eviction representation at no cost in this sort of really unpredictable and tumultuous moment. Shutdowns left thousands of families unsure about where the next paycheck would come from, how they would make rent, especially people who work frontline jobs weren't able to make rent, facing eviction, and all of this because of a public health crisis. So now CEDP has grown, and we work to try and address every stage of housing insecurity. So that is prevention with the Stability Fund that provides rental assistance to clients, tries to prevent evictions, stabilizes vulnerable households, and essentially gives families the chance to stay in their home. Still providing that representation with a law firm that has no cost legal services for tenants who are facing eviction, and then working on systemic change, advocating for housing and economic justice, and supporting and leading legislation that improves outcomes and daily lives of all of our clients. And that can be tenants' rights. It can also be sort of related economic justice things that affect people's ability to stay stable and continue making rent. So we can go to the next slide. Thank you. So thinking locally, what is an eviction specifically under Colorado law? Colorado evictions are guided by the Forcible Entry and Detainer Act. So that defines the grounds and process that landlords can use for evictions. There are 11 types of unlawful detainer that can be cited, but most of the pandemic-related evictions were tied to 3 types. First, a tenant staying in their home after defaulting on a payment. Obviously super common, especially in 2020. But even now, a lot of households are still trying to catch up after COVID, especially people who are working on front lines and in service industries and in jobs that are still being impacted by COVID waves. The second one is a tenant remaining in the home after the lease expires or is terminated. This was common once there was an eviction moratorium, moving from non-payment eviction to the lease is expired and now you're being evicted. And then third, a tenant remaining in the home after there has been a violation of an agreement or a lease. And through the pandemic especially, this was a violation of one of the conditions of their tenancy, but that can happen due to personal and economic circumstances. Really common is having additional family members move in because of illness, because of losing a job, because they lost their place to live. And so these are all things that are very directly tied to the pandemic and to the public health crisis, but are technically violations, and a landlord can seek to evict for those. So next one, thank you. So thinking about how to improve the approach to eviction prevention. At CEDP, we try and stop through both programmatic and policy change, trying to address all of those stages of housing insecurity, and being responsive to the changing economical, social, political climate. Funding changes, courts change, needs change. These recent federal local investments enabled significant expansions of these types of programs. That was funding from the state to do this work, funding through ERA. That really grew the field of organizations doing this work, the programming that was able to be implemented, and that growth really allowed for lessons learned to happen a lot faster. And one of the things that happened was that it really surfaced the systemic barriers and the power imbalances that keep our clients in these cycles of housing insecurity and economic vulnerability. So next slide. So sorry. The passage of SB 173 and HB 1121 last year really changed the eviction landscape in Colorado, and I will go through that a little bit. In 2021, CEDP worked with Senator Gonzalez, Representative Gonzalez Gutierrez, several community and housing partners, some other sponsors, to try and respond to Colorado's eviction crisis, try to implement some of these best practices. The response was really focused on some historic renter issues in Colorado. Specific issues were landlords not having to accept rent beyond the demand period. So even if you could pay before your eviction hearing, if that demand period had ended, they didn't have to accept the money. Renters could be evicted for unpaid late fees. So even if all of that rent did get paid, if there was still a late fee left, could still pursue an eviction. Clients were often unable to participate in that legal process. It is hard to get time off of work. It is hard to pay for transportation. It is hard to navigate this process without help. Take the time, understand what's required, pay to access a lot of these things. In cases of warranty of habitability claims, renters would have to make full payments to even assert that as a defense. And then there were limited to no penalties for illegal lockouts. And that was especially true in places like immigrant communities where there were more pronounced landlord and tenant power imbalances. So we can go to the next one. Thank you. So the policy changes that went into effect in October 2021 that followed that work in the 2021 legislative session specifically addressed a lot of these power imbalances in different stages of the eviction process. So on the front end of trying to prevent evictions, there are now limits to rent increases to once every 12 months, and that applies to any kind of rental arrangements. So traditional leases, but also month to month, or more informal ones with no written lease. And if you don't have that written lease, you have to have a 60-day written notice before there can be a rental increase. And then because late fees are a big factor in that cyclical debt, that make it difficult for anyone who's renting to sort of catch up, there were a lot of safeguards introduced. So that includes fees not being able to be charged until rent is 7 days late and that they can't accrue their own interest, capping the fees at $50 or 5%, not allowing fees to be charged unless it is in writing in the rental agreement, and not allowing evictions just for that non-payment of late fees. And then each of those includes a $50 penalty to the landlord for any violations. Next one. So there were several changes to the eviction process, extending that cure period so that a renter can pay the back rent and stay in their home up until the eviction hearing, no matter how many days have passed. So even if that initial demand period has passed, if the renter can pay and the hearing hasn't happened, that rent has to be accepted. No default judgments before close of business. That just gives renters a full day to respond. We know how hard it can be to take that time, navigate this process. Extending the notice period, giving renters a full week to plan and prepare for their trial. Requiring that there is information on legal aid in any eviction court summons. So just making sure that everyone knows what's available to them. Allowing renters to request documents from landlords, and then preventing those illegal lockouts by introducing a penalty for landlords who lock out tenants without following the legal process, and then allowing the Attorney General's office to enforce those penalties. Next one. And then some of these were focused on health and safety. So specifically in Colorado, the warranty of habitability gives renters the right to live in a safe and habitable home. Previously, renters had to pay a bond in order to use one of these health and safety violations as a defense in an eviction hearing. So if there was a leak or an infestation in the home, it was still up to the renter to come up with that money up front just to have the right to claim that they didn't pay the rent because of that health violation. So SB 173 introduced a bond waiver so that if a tenant can prove they can't afford it, they can get that waiver and still assert that violation as a defense in a non-payment eviction case. And then it also introduced remedies if a tenant is, if a violation is found for the tenant, including damages, requiring the landlords to make the repairs, and then awarding the tenant the cost of the attorney's fees. So why are these all so important? Housing is fundamental to public health and safety. I think a lot of people on this call understand that. That's sort of why we're here, but this was really highlighted during the pandemic, and it made it really clear that the ability of any one family to stay healthy and housed impacts our collective health. So housing people is a public health issue. And the business interests of the few in Colorado have historically outweighed that well-being of individual families, especially those with less power, and then as the community as a whole. So making sure that those who rent places and are landlords get paid and can pay their bills has just been valued more than making sure that people have a place to live. And the power within these systems has reflected that. So SB 173, HB 1121 were a big step trying to correct that imbalance, but we have to keep working on that and keeping that process in mind. This is not the last crisis. There will be another one. And we need to make sure that we are thinking about health and housing as a value in order to guide our thinking, especially in policy, as to how to level that playing field for renters and making sure that we don't find ourselves in another eviction crisis that we know that we have the tools to prevent, or at least make significantly less of a crisis than it was in 2020. So what do we still need to do? All of these changes are really important. There are still barriers to making these protections work for the people who need it the most. Information and education is obviously huge. These changes happened. Who knows about it? Who can use it? Education and partnerships have to include tenants who access services and the landlords who will receive the payments. On both sides, there have been years of bad experiences and mistrust and cultural habits, leaving both groups pretty resistant to external supports and to using these kinds of programs. And addressing that mistrust and building those new connections is really important in making these programs meaningful for whole communities. For our work at CEDP, we've spent a lot of time establishing trust with tenants, but also establishing those relationships with landlords so that they know that when they get a call from the Stability Fund, that they're working with people who know what they're doing and who are going to get them paid. And so they're more likely to cooperate and agree to taking that rental assistance. Language and technology, access to information that is culturally responsive, that is accessible even if you don't have a smartphone or a computer, that is in the appropriate language and the appropriate context, is all really important to making sure that people who need these services, and largely those who have had less access historically, actually know what their rights are and the resources that are available to support them. So you can't just have one approach to getting this information out. You need to make sure that it is reaching the people who need it in a way that they're going to understand and internalize and feel like it is for them. Access to legal representation. Obviously, there has been a lot more support and a lot more conversation about access to eviction legal representation, but just trying to underscore that like these rights that were passed are really important, but it is also really important to have someone who can help you understand what those rights mean, help you navigate the systems, and help you to advocate for your rights. And then sort of similar to the language and technology, but just generally accessible programming and community trust. And understanding that a lot of the barriers to getting resources and access to communities who need them are cultural barriers, and thinking through not just what we offer, but how we offer it. And right now, a lot of this work is funded through limited resources and through pandemic-related funding sources. And so it's extremely important to figure out a long-term plan to invest in these systems and programs and make them as responsive as they can be, so that we have that long-term support for neighbors who are facing housing insecurity, especially because we are facing a growing housing affordability crisis, and generally in Colorado, a growing housing crisis. So these problems aren't going away. We have the tools, and we just have to be thoughtful in how we invest in them.
Awesome. Thank you so much, Melissa. And I'll also do kind of a little shameless plug for CEDP. I know you all do a lot of educational events specifically for renters. So if you're on this call and you're interested in kind of taking this base of knowledge around the new rights that tenants have and giving your community a way to access that information, please look them up because they're a great resource for that. I now have the privilege of introducing Johnny McCraggy with the Denver Indian Family Resource Center. Our last two presenters really focused on eviction and the way that is a big driver of housing instability and homelessness. So Johnny is going to kind of take the baton now to talk about cultural responsiveness, specifically as it relates to our unhoused neighbors. So Johnny, I will kick it to you.
Thank you. Hello, everyone. My name is Johnny McCraggy, and I'm a tribal member of the Confederated Tribes of the Colville Reservation. And I work at a Native organization here in Denver. And I've also been a part of the local Native American Focus Coalition, working to find housing solutions for the Native community by the Native community. And right now I'm currently working to design culturally relevant, sustainable housing services for families in the child welfare system. So next slide, please. So in my researching how to do my work most effectively, I have found that the CLAS framework, if you can go to the next part too. Yeah, the CLAS framework is a really comprehensive way to advancing equity in the service provision environment. So the culturally and linguistically appropriate services CLAS framework is from the U.S. Department of Health and Human Services in the Office of Minority Health. And it's developed for healthcare, but has been adapted for other types of services. And I believe really can be adapted for unhoused neighbors and just homelessness or housing in general. So CLAS refers to services that are respectful of and responsive to individual cultural beliefs, values and practices, preferred languages, and community needs. CLAS should be employed by all members of the organization, regardless of size at every point of contact. And CLAS helps you meet the 6 aims for improving service quality, which is making sure the delivery care is safe, effective, client-centered, timely, efficient, and equitable. And so, like I said, this is adapted for housing. So originally the statement has more like healthcare focus, but yeah. And so this brings me to the edited quote I have at the bottom of the screen, because we have to get away from this idea that, that rising tide lifts all boats, because it doesn't, cookie cutter approaches are not respectful to culture and the individuality of communities and the members of those communities. And in order to deliver more effective care, we have to look at each boat individually and recognize that they have their own unique needs. So I will be sharing more about CLAS at the provider level, at the organizational departmental level, and then also at the systems level. So I'll be doing micro, meso, macro level defining. So at the provider level, these are the frontline folks dealing with clients on a day-to-day basis, right? They are the ones that are making sure that the services that you're providing are being effectively provided to clients. And, because we can do all of this work on the inside and internally, but if clients aren't feeling this and experiencing the shift that you're hoping to, it doesn't matter. So it's important for providers to understand this, because they are really creating the experience for clients. And so at the provider level, CLAS means practicing cultural competency and cultural humility. And so cultural competency is defined as a developmental process in which one achieves increasing levels of awareness, knowledge, and skills along a continuum, improving one's capacity to work and communicate effectively in cross-cultural situations. And so strategies for practicing better cultural competency is learning about your own and others' cultural identities, combating biases and stereotypes, respecting others' beliefs, values, and communication preferences, adapting your services to each client's unique needs, and gaining new cultural experiences. And like I shared, the Office of Minority Health has these really great documents about how to implement CLAS. And so there are documents that help you learn more about better communication styles, and it gives examples about, you know, more commonly in American Indian, Alaska Native communities, you know, speaking more quietly and having moments of silence are more preferred. And, you know, in other communities, talking just like more and more frequently is more preferred. So they really go in and give really good examples, and it's all, you know, researched. And so and then also I want to point out that cultural competency is more about what you do and like the actions, because if you look at the language, it's, you know, it's combating, learning, respecting. And so if we go to the next slide and talk about cultural humility, this is more about internal work and reflection, and thinking about how you yourself are maintaining openness to others' cultural values. And so cultural humility is defined as a reflective process of understanding one's biases and privileges, managing power imbalances, and maintaining a stance that is open to others in relation to aspects of their cultural identity that are most important to them. And so strategies for practicing more cultural humility are, you know, self-reflection, being more aware of your own beliefs, values, and implicit biases, and recognizing what you don't know and being open to learning more, and being open to other people's identities and empathizing with folks, and acknowledging that the patient is their best authority and they are the expert of their own lives and their own situations, and not you, regardless of the position that you hold, and learning and growing from people whose beliefs, values, and worldviews are different from yours. And you know, it's important how the people who are experiencing these services, it's important how they're feeling, because they're the ones interacting on the systems on a day-to-day basis. And so these, you know, classes really communicated through the provider to the client. And so it's just really important for these positions to better understand and better embrace these strategies. And so moving on to the next slide, please. Moving on to, from the provider is the organizational and departmental level. And so it's important to start addressing your own internal framework and policies, because the direct providers can be doing everything that they can be doing in the best manner, but they also are going to need an organization or a department to back them up, and policies and programs and directives. And you know, these programs, policies, and directives need to be developed in a culturally and linguistically approach to continue solidifying cultural responsiveness. And so I believe that the CDC guidance, or CDC has a guidance in advancing health equity and public health, and I believe that it can be used in homelessness services. And it should be, because it should be a part of an effective approach, because homelessness is a part of public health. It is a social determinant. And so CDC has 5 steps that an organization or a department can take, you know, starting with this first step: establish an institutional commitment to addressing equity. And what does this mean? It means incorporating your goals for reducing equity and writing into your mission statement or charter and strategic plans. So, you know, getting it concrete, writing it out, and support your written communications with action. Establish permanent structures such as work groups or staff positions to improve equity practices, so that you're walking your talk. And then lastly, empower your current staff to identify and contribute to equity related improvements. And this is important. It's also important to add in some policies and procedures and protection for staff, and so that they can feel like when they speak up, if it's in opposition of what the current reality is, like that they're going to be listened to, and that, you know, retaliation won't happen, and or that they won't be shushed or anything. You know, having that open line of communication is really important. And then step 2, or if you want to go to the next slide, please. Step 2 is taking a step further, and if you're a funder or a government agency, you know, align funding with your commitments. establish or revise processes for seeking, distributing, and using resources, establish a clear understanding of community needs before seeking resources, and then before distributing funds, make equity a clear component of funding expectations and requirements to guide the actions of those receiving funds. So if that looks like, adding in to the ARPA that you're requiring hiring and collaborating with representatives from underserved communities, and or require racial equity training, and develop criteria for prioritizing interventions based on needs. As a funder, you definitely have a lot of power to help shape those systems. And so by doing that through the funding requirements is really important. And so the third step is being deliberate about increasing staff capacity. Re-examine and expand recruitment efforts through outreach to members of professional affinity groups and specific cultural networks, because there are people in the populations that you're trying to address who know and can do the work. And so going out and finding them is really important. And, bringing in new skills and perspectives by making experience working with underserved populations or the specific population group or group that you're trying to address as a priority in job qualifications would make a really big impact. And widely distributing the job announcements to making sure that you're reaching out to staff and to engage staff with skills addressing equity, and establish expectations that staff and management engage in activities designed to advance equity, making that the norm of your organization or the work that you're doing so that everyone feels like they're contributing to it and, want to contribute to it. So whether that's like having training requirements or work group participation. And it's also important to hold staff accountable for these activities and training or performance plans. Next slide, please. And so the fourth step is integrate equity into your services or resources. Get real feedback from community members, have conversations with people who are coming into your office or that you're meeting on a day-to-day basis, and make sure that the services to improve that and ensure that your services and resources are culturally and linguistically appropriate, and modify the services as needed. Take the energy and the efforts to improve your work to better reach your community members. And so if that's like bundling services to reduce the number of visits or adjust service hours or anything else that is coming from those conversations. And then find ways to improve efforts by tracking those who are benefiting from your services and resources so that you know that you're making an impact. And it's also just as important to identify and find out why folks are not participating in the services. I'm sure that they either need it more or just as much as the current clients you have, but really figuring out what about our work is not enticing to you to take the energy and time to come to us, because if you need it, we want to make sure that you're coming to us. So how can we shift and change our work? And then also, most importantly, be transparent and share the anticipated improvements with community members after you've gotten their feedback, because this reinforces that they were listened to and that their voice matters. So next slide, please. And so at the organizational, the fifth strategy is establish multi-sector collaborations or relationships with diverse communities. One community, one department cannot do all of the work, and so really relying and building meaningful relationships with other communities and other folks is really important to really address equity. So next slide, please. So we've talked about providers, we've talked about an organization, and now we need to address the system. This is about addressing the root cause of homelessness in your community, because you can equip the providers with the best knowledge. You can make sure that your policies are in place in the organization. But if you're not going up the stream and looking at why people are falling into the stream, it's not going to do much, and it's going to hurt more than have any improvements. And so, at a systems and governmental level, you can start with your data and disaggregate whatever data you have by race, age, gender, income, or more. And it's important to disaggregate, because if you're not able to see who's really being the most impacted or not being served the most. And then after you do that, analyze your data and determine which groups are being disproportionately represented, and try to cross-reference it with other sectors, such as like the criminal justice system, or who's being who has the highest incarceration rates, or with mental health, or other sectors and issues. And then the next step is going to the people after you determine which group has the most or who's the most disproportionately represented. Engage people from those communities and pay particular attention to the people who are directly affected. So if you are reaching out to the Latino community, make sure you're also reaching out to folks who are Latino and experiencing homelessness, because it's important to hear directly from the people who are being who you're trying to address. And using CLAS in these engagements, because it's not enough just to engage the people and talk to them. It matters how they are engaged. And so you want to ask good questions. What isn't working? What would you do if you were in charge, and how would you do it? And it's important when you're meeting with folks to use plain language and not to use a language that only staff or the people working or who are directly a part of the work and providing the services would only understand, because you're going to make people feel invited, and people are going to feel more open to share, versus if you're continually using acronyms or work like talk, it shuts people off and makes them feel like they're not a part of it. And so next slide, please. And after you get the real feedback from people, implement it and tie it in with the best practice models that you're looking at. And then after you do that, tell the communities that you've engaged about the changes you've implemented and how their feedback played a part, so that you are showing that they were listened to and that their opinion matters and their life experiences matter. And after a while, after the changes you've made have been going on, go to the people again and ask them, was this what you meant? Is this is the work that we're doing now based off the feedback you gave, is it making a difference? Is there anything that we can do to change it? And so if there's corrections or if there's more feedback, update and implement again, and just continue making room at the table and building those really meaningful relationships by using CLAS and using these strategies, and will help you bring people to the table and make sure that they keep coming. Because if you're being listened to and you feel like the feedback you're giving is really being is impacting the work, that would encourage someone to come back. And so, and then lastly, continue to monitor and analyze the data and results, and track to see if from where you originally started before all the feedback to after the feedback was implemented, did that really make a difference? And if it did, continue improving, and if it didn't, change things up again. So I think the last slide, yeah. And so again, I go back to the quote that I had at the beginning, that or the modified quote, that a rising tide does not lift all boats. And in order to reach net zero, you need to implement culturally and linguistically approaches. And folks are not being currently helped with the current systems, and so we need to hone in and figure out why, and adapt those services to people. So I do also want to encourage for folks to reframe your thoughts about these approaches and these models. They may seem like they're idealistic, or that they take a lot of time, or there's a lot of energy, or just unrealistic, but I want you to reflect on your own personal experiences about a time when you were directly impacted by a decision someone else made without involving you. Were you hurt? Were you frustrated? Were you angry? Did you feel powerless? That's how folks are feeling when they're on the other side of receiving the services. And so we cannot address inequities if we don't address how we relate to people facing them. And then the next slide is just the sources where I got this information from.
Thank you so much, Johnny. Really appreciate you taking the time to share that with us today. Last, but certainly not least, I want to introduce Dr. Kathleen Van-Boris. She is the Chief Executive Officer with the Community Investment Alliance, here to talk about best practices for addressing homelessness in our communities. I will hand it over to you, Dr. Van-Boris.
Thank you, Matt. Good afternoon, everybody. And thank you again for joining us today. I know these are long, but very important topics. I am here today to talk about best practices for addressing homelessness, but specifically at the local level, at the community level, which is where we're seeing a lot of efforts, especially beginning when COVID hit. I did want to clarify, there were a couple comments about one of our polls with the increase of 33% between 2019 and 2020. And the comments are correct. We have more than doubled, at least from what has been strategized by most of the individuals who are doing surveying and counting throughout Colorado, that we have more than doubled our unhoused count in the state of Colorado from 2020 to present. We will learn more moving forward, and we're going to talk a little bit about how we're trying to get some more clear and accurate numbers at the local level that we can then pull together to get a broader image at the state level. Next slide, please. So again, we're going to talk really closely at the community level. Every community is different. So for those of you who don't know me, I have been working for over a decade at looking at continuum housing, working with emergency solutions, asylum solutions, sheltering programs, external community development, all the way through attainable housing. Every community is different, not just land availability and codes that we have to look at, but it's different in who is experiencing homelessness, what subpopulations, what their barriers are, what the gaps in those communities are, as far as services, housing, resources that are coming in. And so it's very important as we try and address how are we going to move forward with our unhoused populations and serving them and ensuring our community is well established to take care of everybody, both housed and unhoused. We need to make sure that we understand the true problem. So as I said, some of the most important questions you need to know is, why are people experiencing homelessness? We know that there was an increase, and we heard that from both Peter and Melissa. We saw a pretty significant increase of individuals who became situationally homeless during COVID. Situational homelessness existed before COVID, but of course we saw that exponentially increase. We saw individuals who their leases weren't renewed. So even if the eviction moratorium allowed them to remain in their apartments, their leases weren't renewed, and we saw a huge tidal wave of individuals who fell into the continuum because of that. We know that we've hit the 8th most expensive state to live in the last couple of years. That has also created a tidal wave of individuals who cannot find housing. But there are many other reasons. For example, we know that in a lot of our college communities here in Colorado, we have a lot of college students who are living in their cars, or who are camping, or who are sofa surfing and cannot afford to have their own or attain their own housing. We saw an increase in domestic violence. There's about an 80% increase nationally in domestic violence victims with not enough resources or shelter beds and protective services to take care of and bring on that many individuals who are fleeing abusers. So there's a lot of different reasons that we see individuals living unhoused in our communities. Is something that we need to identify on a community level. Again, we need to know what their barriers are. We need to know what their needs are. And today we're really going to focus on the best practices of creating programs based on lived experiences. So the most accessible programs with the highest rates of success are all based on feedback of lived experiences. There's a couple ways that we collect this data. If you're saying, where do I start right now if I were to meet tonight with everybody and come up with a plan? The first step is always to create a baseline understanding. We have certain communities, La Plata County has done this, Rocky Ford has done this, who have done both tally count and surveying over the last year. Tally counts are relatively new, but they're wonderful for two reasons. One, they're trauma informed. And two, they allow us to have a baseline number of the individuals who are unhoused. A tally count is a volunteer-led effort. Volunteers show up, we map out the entire county. Volunteers go out for a very specific 2 to 3 hour block of time, depending on the location, and we physically count the individuals we see who are unhoused. We count tents and we count cars. We do, of course, do this in a way that allows us to guard against what would be considered double counts, which is why it's done within a window. But I do also want everyone to know that with point in time counts, tally counts, any form of information gathering like that, we will always have an undercount. We are never going to be able to count every single individual who is unhoused for a multitude of reasons. The other effort that we encourage as a best practice for all communities to do is a surveying effort or an outreach effort in which you are going and actually interacting with those who are unhoused and asking them these questions in a very trauma-informed way. So not asking for identifying information, but asking them to let us know what made them become homeless, what barriers are they facing in obtaining resources or in moving forward in stability. What resources do they see they need? What programs would work for them? If you have current programming, why are they or are they not accessing it? That information is all core to being able to create programs that you would move forward in your community. Next slide, please. So one of the things that I encourage everybody to do, especially as we start to talk about our unhoused neighbors, is really moving away from this mindset of managing homelessness and moving towards ending it, moving towards creating programming and resources that truly not just address that we have it, but help people move towards long-term stability so that we can continue to move people through the continuum. Next slide, please. And so I've mentioned the best way to do this is lived experience programming. Now, this is seen no matter how you want to look at this. We have looked at financial research that shows that if you base programming off of the qualitative feedback of lived experience, that it has a much higher success rate. It's like 73% higher success rate. Again, the reason best practice models are all based off of lived experience is because if we hear what people need within our own communities, we know what's lacking, we know what we need to strengthen, we know what's working, then we know how we can help people connect and move forward. Again, different experiences, different types of homelessness, whether it's situational, episodic, or chronic, as well as depending on why you are homeless. If you are a foster youth aging into the continuum, if you are a domestic violence victim, if you're somebody who's struggling with PTSD and intense trauma, no matter what the reason is, we have to be able to meet with specific resources. And the best way to do that, again, is to understand from those individuals what they need. Next slide, please. So the best practice, no matter what program we're looking at implementing, is really to make sure we're looking at it through the lens of trauma-informed care, or TIC. Trauma is a human response to a stressful or life-threatening experience. At some point, all of us will experience something that is traumatic. Being homeless in and of itself is a trauma. It is a consistent trauma that individuals who are unhoused live with day and night. It is a trauma that remains in the body and keeps you at very high alert. When you are in a constant state of trauma, meaning you don't know where you're safe, you don't know where you can sleep, you don't know where your next food is going to come from, it is very hard for you to focus on, how do I move forward? How do I make certain connections? We know that people in states of trauma really can only cognitively understand every third word of what we say. And so through that research, a lot of times the habits that we see with individuals who are unhoused, we write off as they don't want to follow rules, they're not listening to rules, and that's not necessarily the case. So trauma-informed care has become really big, really in the last 5 years, as becoming the lens and the overlay of how we look at individuals, we learn their past, and we're able, again, to meet them where they are, understanding that for some people, that's going to be getting vital documents. We need to get a birth certificate, we need to get you an ID. For some people, it's simply gaining their trust. We have been set in a way where we have tried to fit individuals experiencing trauma and homelessness for decades into cookie cutter settings. And Johnny had mentioned this a little bit as well. We developed emergency sheltering and solutions and expected people to fit the requirements and the needs to come into those programs. That doesn't always work. Inevitably, it has not worked, or we would have ended homelessness. So what we're asking is for everyone to understand that people that are unhoused are experiencing trauma. They have experienced trauma. And so getting to know them, meeting them where they are, and developing programs based off of the needs of those who are truly unhoused will allow us to move individuals forward. Next slide, please. So again, we've seen that trauma-informed care nationally has had a positive effect on housing stability. It has a positive effect on trust with individuals, trust with service providers, trust with accepting and getting to those stepping stones of stability. We've seen that it's led to a decrease in crisis beds. We've seen that trauma-informed care and being able to meet people where they are, again, moving them forward, but moving based on their story and at their pace, also has a long-standing effect of stability. It is cost-effective because we are not having people go into a program and then fail out. If we put people in housing who haven't been in housing and we don't offer them services and support, we're setting individuals up to fail. Trauma-informed care also leads to better outcomes of self-esteem, improved relationships, and increased safety. There's a pretty amazing study going on right now nationally with pallet shelter, just looking at the difference between offering somebody a tenting solution versus offering somebody a pallet shelter, which I'll show you a picture of here in a minute, which actually has the ability to lock a door. And the simple difference between being able to lock your door at night and having to worry about your own safety, and the difference in how many people then take those next steps with connection of resources, employment, food, any of those resources. Next slide, please. I'll go over this really high level, but again, can talk about this more deeply with anybody who'd like to. The other best practice is really to create a program based on a housing first model. This fits right in with what we've been talking about. Again, housing first states that we are going to provide housing and make sure that people are truly safe, right? They are hitting those Maslow hierarchy of needs. We have safety, we have food, we have water. We are able to go to sleep at night, lock a door, know that we can wake up in the morning and move forward. Housing first does not require you to meet the requirements of becoming sober, having a job, all of those things that we hope people will achieve. Housing first models have proven unbelievably successful around the world. Getting people housing, again, being able to lock your door, being able to have a good night's sleep, being able to connect then as a human being, understanding where you are, heal, move through trauma, allows people to then find those stepping stones to stability, rather than trying to do it backwards, where you have to try and get a job, get the funding, get food resources, get support, and then move into housing. Next slide, please. So I'll go a little deeper in a couple of these areas, but again, happy to talk more about other areas we don't cover today. There are 6 areas we really do try and focus on. Again, prevention and diversion, housing and shelter. How are we going to ensure that everybody has a safe place to sleep? And what does that look like? Because the best practice of what sheltering looks like is changing widely across our nation. Supportive services, collaboration, really looking again at community impact. How are we ensuring that our housed and unhoused neighbors all have safe, clean, and happy ways of living within our community? And then education, awareness, and stigma, and the importance of making sure that we evolve our programs as we continue to move forward. Next slide, please. So prevention and diversion. We heard a little bit about this today, right, with evictions, but if we are truly, again, going to look at how do we end homelessness, how do we help homelessness, how do we ensure that it's minimal in our communities, no matter where you're at, you have to focus on prevention and diversion. You're going to have to make sure that we stop the pipeline of individuals who are falling into our homeless continuum. That is through a multitude of things. And I applaud many of you who are on this call today, because you've worked really hard over the last few years to utilize eviction prevention funds, to help utilize mortgage assistance funds, heat funding, water funding, really assisting families in all of your communities. These things really help. They help for many reasons. It is much cheaper to prevent and divert people from hitting the continuum. It is much easier for us as case managers and service providers to rehouse and to serve those who are falling into prevention diversion than once they hit that continuum. There is a 45% higher chance they are never going to make it out of the continuum if they fall into the homeless continuum, if they hit the straits. So prevention diversion is key for all communities. Next slide, please, Matt. So again, sheltering systems. So I have done everything from creating and building family shelter systems where it was a 30-day individual unit. I have run chronic homeless shelters. I have run women's DV shelters. And I have run a multitude of encampment type individualized unit shelters. Here in Colorado, actually Aspen-Pitkin County was the first during COVID to open up and do an encampment and have an area where people could come and camp and receive services. We then saw Denver do it. We saw Grand Junction do it. Aurora is now doing pallet home sheltering. We're really seeing this as something that's going across the nation. There has been a push away from traditional sheltering, congregate sheltering so that you're not close to each other. Now we saw a reduction by 56% at all congregate sheltering across the nation during COVID because of health guidelines. That increased even more so as we needed to have areas in where we could isolate individuals who did test positive for COVID or had been exposed for COVID. So we saw an incredible reduction in the amount of individuals we could serve in congregate shelter. It was also an eye-opening moment for everyone around the nation and many advocates to really say, does this work? Does this offer an opportunity? Is it safe? And we saw many people who wouldn't go inside or who couldn't go inside. Someone who is in a complete state of trauma has triggers, may not want to sleep a couple inches from another individual, may not be able to listen to yelling or shouting or talking or feel safe at all if they don't have their own area. This has been a solution that we have seen, and it has worked really well. At every single one of the sites that we have seen and helped structure in our state here in Colorado, we have not seen an increase in crime. What we have seen is an increase in success. I had the honor this morning of being on the phone with the city of Aurora, looking at their pallet shelter sites. The pallet shelters are at the very bottom. There's the little white ones. They come as a lock, so you can actually lock the doors. They had previously had those Eskimo tents, the ice fishing tents, which is something I had also utilized up in Alaska. The difference in general from moving from ice fishing tents to pallet tents has been amazing. The city of Aurora has noted they've been able to house about 40% of their individuals who came to them who were chronically homeless, individuals who came to them who were very not interested in receiving direct services, who needed to gain that trust, who all had their own trauma triggers. These sites were set up again through a trauma-informed lens. We met each individual, we learned their stories, we gave them time to trust us and see that we were there. Individuals now have a rate of about 3 months in one of these pallet shelters, and then they're actively getting into housing or other forms of resources that are helping them. One of the things that we hear most is that this is something people would rather have over congregate sheltering. They feel safe, they can leave their things, they can lock their doors, they can get a good night of sleep, they have a clear head in the morning, they know where they can sleep, eat, shower, and have basic needs. So this has been something that a lot of communities have been able to do and have utilized some of their ARPA funds to do. Next slide, please, Matt. The other thing that we're seeing a lot is individuals living in their cars. Now, this was something that, of course, happened for decades before COVID. We saw a lot of families as well who would live in their cars. One of the things that is kind of new is that we're starting to see we can't afford that. So, for example, we know we have a county where we had one of their deputy DAs who was living in a car. We are the 8th most expensive state for housing. Everyone on this call knows it. We've talked about it now for 4 weeks. Car living is becoming much more common. RV living is becoming much more common. Again, I had the honor of being on calls this week with multiple sheriff's units to talk about how do we best address this when you don't know where they can go. One of the options that we're seeing is safe parking. Safe parking has been popped up in a multitude of counties and cities. We've seen these models where families can be. We've seen models that are for RVs. We've seen models where it's for cars. We have one site that serves only women. We have a site in Colorado that serves seniors. These sites are great because it's a safe place to be. These sites are met with, there is a safe parking initiative, there's bathrooms on site, and then they're met with case management. Again, the goal is to set up a program where we're meeting people and getting them into the resources they need, which is really hard to do right now, especially if you're trying to navigate living in your car. Next slide, please. And then of course, housing, which we could talk housing for decades, everyone on this call, whether you're rapid rehousing, whether you're looking at doing permanent supportive housing, whether you're looking at and trying to figure out how to use your vouchers or how to place people with vouchers, or looking at even motel conversions. Durango's doing a phenomenal motel conversion right now, which is going to serve so many within their community. Housing is always a solution. So while we talk about pallet shelters are a first step. Permanent housing is always the long-term goal, no matter what programming we are putting into place. And we again can talk more about what type of housing in what community. A lot of that depends on land and who you're serving and what the need is. Next slide, please. So collaboration. Again, I know a lot of you on this call because we came together during COVID and we started having monthly calls. And I have been honored to be able to lead a lot of those. Collaboration is going to be key for us to move forward. We know that we have a massive unhoused population across our state. Within communities, in and of themselves, the communities that are doing the best with trying to actively serve those who are unhoused are those who are coming together in coalition, those who are coming together to meet service providers, elected officials, police officers, really having an understanding of what the struggles are, what they're seeing, what those barriers are. Being able to share resources. Resources are scarce, especially if you're in rural communities. Staffing is scarce across really all service providers right now. So being able to collaborate on what is going to be the best program, how are we best going to serve those who are unhoused in our community, and how do we work together to share what resources we have so we're not duplicating efforts, so we're bolstering efforts, is really going to be key to moving forward within a community. Next slide, please. And then community education. Being unhoused tends to come with a lot of stigma. We all know that. One of the things that we have found in all communities that we work is that we really need to be able to offer community education and ongoing education. Again, the way we've looked at homelessness in the last decade has evolved tremendously. For a lot of people, the understanding of who is unhoused and why they are unhoused needs to be shifted. And so being able to come together as a community and talk about what is homelessness? What is homelessness in our community? What are our fears? What is it causing? And being able to, as a community, continue to be educated on different things about houselessness or housing affordability or community engagement, making sure that unhoused and housed alike feel like they're part of that community is very much key in making sure that we're moving forward successful programs and programs that are supported by our communities. Next slide. Thank you so much.
Thank you. So at this time, we are going to move into our panel discussion and Q&A portion of the presentation. If you have a question that you'd like any member of our panel to answer, we'd encourage you to drop that in the Q&A. I'm going to go ahead and stop screen sharing so that we can all kind of show our faces here as we enter into discussion. You can direct your questions either at an individual presenter if they had something specific in their presentation that you would like clarity on or that you'd like further discussion around, or you can direct your questions to the group as a whole. And we will do our best to address them. I wanted to kind of throw one in here just to kick things off and get our wheels turning. This question is for the whole panel, so anybody who wants to kind of address this. Can you talk more about the connection between eviction and homelessness?
I can start, and then Kathleen, you could probably add. I think I'm really grateful that this conversation is happening with both of those issues together, because that's the whole thing. Like, you know, the last couple of years in this work, and as we've seen these problems grow, is like, oh no, what do we do now that there's all of these people who have nowhere to live? And the answer is that you do things before, you put things in place, you even the work we do, which is the rental assistance and the legal representation that helps to pay so that people don't have evictions coming their way, or even to stop evictions that are already in progress, that's still pretty far down the line. So it's still a band-aid to challenges, which I think Johnny was starting to talk about, that like really the upstream is how do we think about housing differently, and how do we make sure that it is affordable, and how do we make sure that it is a value that we have and not just a commodity that has to be managed. And then that will really drive better decisions and programs and whatever it is, in order to not have to have these last minute things like holding off an eviction at the last minute and getting money through before the sheriffs get to the door.
Absolutely. And I would add to that, that again, that's the prevention, right? The prevention is really making sure that people can stay housed. The policies that Peter talked about, the policies that Melissa talked about, right? Having those safeguards in place where we can keep people in housing, knowing the work that 9 to 5 in Colorado is doing as well to keep people in mobile homes, right? Affordable housing units so that they're not bought up. Those things all matter. Realizing that the reality is we still have people who end up evicted, trying to make sure that we have programs that again do the diversion portion. So, and again, to pick on Melissa, so CDP has a phenomenal diversion program for those who are evicted that does hotel people, that does offer them case management and then gets them back into housing before they can hit the continuum. Again, that's vital. Making sure people do not hit the streets. I can't stress enough that evictions on records are so hard to house. And so, you know, having safeguards in place, I have individuals who have master's degrees. They had an eviction because they had COVID and they couldn't pay their rent. And, you know, they're full-time, they work full-time, cannot afford housing, cannot get housing because of that eviction. And they have nothing else on their record but that eviction. And it will haunt them for the rest of their life. You know, it's the same sort of thing as a felony, right? Making homelessness illegal, as we see in Tennessee right now, as an example, right? You get a felony for sleeping in a public place. That hitting your record makes it impossible for us to house you. So, you know, when we talk about things like prevention and diversion and creating policies and creating programs that are really going to help people, we have to look at, is what we're doing a reaction, 1, to fear, 2, to saying, oh my goodness, we don't know what else to do? Or is it actually something that's going to create that shift, create that change, create a long-standing guardrail so we can ensure that people stay housed, can be rapidly rehoused, or have a path to programming that's truly going to support them back into stability.
Yeah, that's a great point. I would just add from a high level that in thinking about eviction and homelessness, it's just important to recognize that there is no clear one-to-one relationship here, right? There are many more people who face the threat of eviction every year than who are homeless at any given time. We know that people who face eviction face an increased risk of doubling up in housing and who face an increased risk of homelessness. But there are also many people who go through the eviction process who don't end up homeless, although who experience considerable hardships regardless. And there are many people who are homeless who ended up homeless, unhoused without being evicted from previous housing. These are clearly related issues, but I think it's important not to conflate the two.
Excellent. Peter, we actually had a question specifically for you. This from Ashley. Ashley says, Peter mentioned that we have a lot of data about different types of rental assistance programs across the country. And Ashley's interested about where that data can be found.
Yeah, absolutely. So the National Low Income Housing Coalition has done some really good work surveying rental assistance grantees across the country. They've developed a database. I'll put a link in the chat where you can find a lot of kind of basic information about the ways that those programs operated. We're talking, 400 plus programs across the country, and there's a lot of variation in exactly how they work. The Housing Initiative of Penn has also started doing some evaluation work, tying those characteristics of rental programs to their effectiveness in moving funds to renters and to landlords quickly. So I think this is an area where we're starting to see more work, but clearly a lot more work to be done too.
Excellent, thank you. A question from Dawn. So Dawn makes the observation that we've had some challenges with the governor, specifically around some hesitance around policy regarding land ownership. Thoughts about strategies to get things across the governor's desk in this current environment, noting that, on 1287, which was the protections for mobile home park owners bill that we referenced earlier in the presentation, for example, Dawn notes that Polis significantly altered that bill as a result of a veto threat. So thoughts, I guess this would be specifically for folks who are involved in state policy. What are some strategies for we're obviously working in the politics is all about working with and alongside people who have a wide range of political views about how we get this done. So what is the current strategy in this environment for enhancing renter protections while also knowing that maybe not everyone is going to be fully on board with the ideas that are put forth as far as policy goes?
I'll go first, Melissa, but then I'm totally kicking it back at you. I have a doctorate in policy, and I will tell you that everyone is having this conversation right now, including on a call with the White House yesterday, in the sense of how do we go across political divides and really have the conversation about land and housing and rights and protections. And again, I think a lot of it is coming down to education. And a lot of what we're seeing, and again, Melissa, 9 to 5, Together Colorado had really put out campaigns this year to educate, and we saw a pretty significant shift in some of the responses that we were getting, just education around mobile homeland, right? Mobile home ownership, what those challenges were. And I think it's going to take a lot of continued education and commitment to move that forward. I think, in all honesty, we're always going to see harder policy pushes during election years. We're always going to see that. And I think it's going to be important for our communities, our local officials, our nonprofits to continue to engage, to continue to write letters, send emails, talk to those making the policy, talk to those who are at the state level, and really let them know how these policies would benefit, right? Policies that Peter brought up, policies that Melissa brought up, how they would benefit their local community, especially in rural communities. We saw a real lack of rural community voice, and not because the rural communities weren't trying to speak up, but because I can't tell you how many times during legislative session this year, we actually heard, that mountain towns were rural and Metro Denver had rural areas, but we weren't hearing from Cortez, and we weren't hearing from Rocky Ford, and we weren't hearing from Fort Morgan. And those places, those voices are so real. And so I think the more that those voices are amplified, the more we're going to be able to see a shift and a change in that dynamic and that policy.
So, and looking at your comment, Dawn, too, that it was specifically about the landlord versus tenant sort of rights and that balance. I'll say that I am weirdly hopeful and The reason being, like, having grown up in Denver and worked in housing spaces where it was really hard to get people to pay attention to housing issues because it was a niche issue. It was like, gentrification is happening here. This is a concern for some people. It was not at the forefront of everyone's mind. And what has happened in the last couple of years is, one, housing has surfaced as a top issue for everyone. It has become very clear how important it is and how it impacts everyone's life. But two, people have been forced into conversations about racial justice and inequity and how these systems were built and what they mean and why they work the way they do. And so conversations that were really difficult 5 years ago to even get people to listen to or have interest in having, now there's at least an understanding that you have to engage with that. So, well, I mean, this is still a new shift. This is hard, getting to adjust, getting people to the point where they're comfortable with adjusting the balance of the rights and the power between landlords and tenants, but for landowners in Colorado. Like, that's difficult. That is deeply entrenched in Colorado values and the way that our government has been set up at a state level and most municipal levels. That is hard work, but it is a conversation that now has a foundation that it didn't have before. We can have conversations about redlining and why displacement is happening the way it is and who it impacts and why it's important to have policies that are responsive to those different histories in a way that we weren't having before. So this work is hard. Not everybody's in the same place, but we are moving the conversation in the right direction. And the more that we can shift the way that we talk about these things and the way that we frame this as a holistic social, racial equity issue and not just a landowner issue, the more I think people really understand the impact and the weight of these policy decisions beyond just like how much rent you're allowed to charge.
Awesome. That was good stuff. I was curious how y'all were going to answer that one, because it's not the easiest question to field, for sure. We have a question here from Kathleen specifically. This is from Bryce. Bryce says, has your research worked to categorize the severity of needs required amongst those who are unhoused? Thinking about the housing first model and using the data to focus more resources on those individuals who require the most attention from public services like police departments, clinics, hospitals, EMT, et cetera.
So I want to make sure I understand the question. So I'm going to read this back. So focusing on those who are the most high acuity, so need the most resources, are the most advancing, and how they're succeeding with housing first.
I'm going to assume so. And
okay.
So almost how do we, and Bryce, feel free to chime in here if we've misrepresented your question, but I'm assuming this is regarding how do we triage everybody who's part of this homelessness continuum? How do we make sure that those who are most high needs receive the high level of care that they require?
Yeah, so again, meeting everyone where they're at. I think that triaging with case management and with outreach, we can identify pretty easily from history and from feedback, individuals, and through, again, having that collaboration where we have hospitals and fire and police and service providers kind of working together and having broader conversations, especially in smaller communities. For those who are more chronically homeless, or for those who are on the higher end of episodic homelessness, so they continue to fall in and out of homelessness due to disabilities, mental health, things of that nature, those are the hardest to serve for every community, because they are the highest crisis response calls. They tend to be the individuals that we see police calls for more, things of that nature. I would say that as your community, we're doing that in Aurora, and we're seeing that done in La Plata County, where there's really talking about who's doing what and how do we engage. For every community, again, it's really looking at your continuum. It's going to be looking at the resources that you have in place. And if you know, again, part of having those surveying and the outreach effort is going to help you have a better understanding of the individuals who are on the street and whether or not they are chronic, episodic, situational, and what the level of need you will need in your community is. If you identify that the majority of individuals or a higher percentage of individuals are going to need that intense care, are going to inevitably need permanent supportive housing, those are the conversations then that you have. Do you have the structure? Do you have the resources? Who are the identified service providers that serve individuals who have higher acuity needs? Those conversations are vital. And those are a lot of the providers right now who have always been underwater, but are extraordinarily underwater right now, and especially since COVID. So making sure, again, that what did they need? What do those service providers need in order to provide those services, as well as those individuals? What do they need to feel support? Are they accessing the services that you currently have? That's going to be the biggest question. So triaging for those of us in the service area is going to be fairly simple. It's going to be really looking at, do we have the right resources in place on the ground to ensure that we're offering service instead of just, police calls, going to the emergency room, things of that nature that are more repetitive. And I hope that answered it. I hope that I understood that correctly.
Excellent, thank you. Bryce says yes. Thank you for that answer, Kathleen. Another question, this one also from Don, are any churches using land or their buildings to provide housing in Colorado? Don says, I've heard about it elsewhere and for safe parking, but not for housing specifically.
Yes, so we have seen in a few rural communities where they're doing transitional type units. So they're converted. We have a couple congregations in rural communities who've converted a classroom or converted an office and are helping people, again, stay there while we try and transition them into permanent housing. Congregations have been really a standing leader in the state of Colorado for opening up to safe outdoor spaces, to opening their land up to pallet homes, safe parking, even overnight sheltering. That's not something that was new with COVID. Congregations have kind of filled in across Colorado for really where we have housing gaps for decades. There are some very fascinating in Portland, as well as up in Maine. There's a congregation that, again, we're seeing congregations whose congregations dwindled during COVID when they went online, as well as just aging congregations. So we're starting to have broader conversations with congregations about actually converting their churches and or utilizing their land for affordable housing. We have done that. We are actively engaged with some congregations here in Colorado who are looking to do that with their land and with their congregation moving forward. Again, that's the whole housing process. So it's not necessarily something that's really quick. Portland and Maine have really shown some phenomenal just going in and converting, almost like a motel conversion, some of the rectory offices and things like that. But there is an Enterprise Community Partners actually has a national push for congregational land transformation into housing. So happy to share more of those resources as well.
We had another question just roll in that says, so according to One Home, which operates the continuum of care for the Metro Denver area, someone must be chronically homeless for at least a year to qualify for permanent supportive housing, PSH. What other resources are available with individuals with a high level of service need? So I assume that would refer to folks, right, who maybe haven't they're not at that 1 year threshold, but they clearly need that kind of resource and attention level.
Absolutely. So we do have a lot of low-income tax credit builds and a lot of low-income housing. And I do actually have a phenomenal spreadsheet, and I can give that, Matt, to you if you want to send that out. It's a statewide spreadsheet of those resources. Wow. Where it's based on income, but still has people on site. So we're still able to make sure that individuals have access to somebody. And then also really depending on where those individuals are, always trying to make sure that they're linked up with a program depending on what their needs are so that we can move them forward.
Excellent. We have just a few minutes left. So if you have any last minute questions, please drop them in the Q&A. I was curious, Peter, while we have you here, I noticed Maryland is a real outlier in the data. What's up with Maryland?
Yeah, Maryland is the worst of all possible worlds. I say that with all respect to anybody from the state. They have the filing fee in most of Maryland is $15 to file an eviction case. There's functionally no notice requirement. Basically, it's become institutionalized that landlords will file for eviction immediately after rent is past due in almost all cases. And they will do this repeatedly against the same household over and over and over again. There is a fairly extreme right to redemption in Maryland. So even if a judgment goes through, tenants are able to then cure the case and maintain tenancy in the unit even after a judgment goes through. So more of those judgments are also less likely to end in actual evictions. But the whole combination of factors has led to extremely high eviction filing rates. The Attorney General of Maryland, Brian Frosch, has been trying the last two legislative sessions to push forward a few bills that would change the basic regulations around the eviction process in the state and try to send them down in the rankings. So far, that hasn't gotten a lot of traction within the legislature, but they're going to continue to push on that.
That's fascinating, and I think a real sort of case in point about how lack of regulation and sort of policy that does not protect renters actually has a very measurable impact.
Right. Yeah. And then it becomes, this is one of those situations where the system does not work well for tenants or for landlords in this case. And I think what they've been trying to do is build something of a coalition that would make this argument that this doesn't work for either side. And there is a better way of proceeding that would result in far fewer eviction cases being brought every year.
Well, I am seeing that our question queue has been completed. So I will allow you all to get to your weekend and enjoy this summer day. Again, as always, thank you to our presenters for offering your time, your expertise, and being with us on this Friday afternoon. And as usual, we'll have this recording out and in the world sometime, hopefully early next week. So keep an eye on your inbox if you want to share this recording and slides with others who may benefit from this presentation. And with that, I will let you all go. Thank you so much.